Okay, everyone, it's Michael again here, and we are going to be talking about the disorders of the body systems. Now, as home health aides, we need to be knowledgeable about different things or diagnoses that a lot of our clients are having. Even if you are a homemaker or just a caregiver and you're not providing medical services, it's also important that you are aware of the different disorders of the body systems and to also know what possibly is going on with your client as well. So in this section, we're going to be talking about the disorders of the body systems. Now, I want you guys to bear with me. This is a long section, but where you want to be able to make sure that you guys get full information about what is important about these body systems and the disorders of them. All right, so let's talk about acute and chronic. You probably have heard these two terms before, and if I ask you what is an acute illness and what is a chronic illness, and can you kind of differentiate between both of these? Now, when we say something is acute, it is an illness that has severe symptoms and is usually short term. Meaning that an acute episode, it just happened right there and then. It's recent, okay? It's right there and active. And it's like a short-term level. Now, a chronic illness is a disease condition that is a long-term or long-lasting. For example, if you are diabetic and what happens is it's a chronic illness, it's going to be with you for a long period of time. It's never going to be something where it's just going to come and go. You can kind of ease up and alleviate the symptoms in it, but once you are a diabetic, you are a diabetic. Okay, next thing, pressure points and bony prominences. So these are very important to know. So pressure points, these are the areas in the body that bear much of the body's weight. So this is very important for us to know for a lot of clients who are not mobile or cannot really move themselves too much. And we will discuss that further on and why pressure points are so important to be looked into. Bony prominences are the areas in the body where the bone lies close to the skin. Okay, so let's go ahead and talk about some of the disorders related to the integumentary system. So what is the integumentary system? It's your skin, okay? So let's know some facts about pressure ulcers because this is one of the big skin conditions that occurs to a lot of elderly people. Okay, so a pressure ulcer is a wound that results from skin breakdown. Okay, so immobility, warmth, and moisture is what will contribute to skin breakdown. Now, what happens is we classify them in 4 stages, okay? And as the stages go up, the higher stages, it becomes more difficult to heal, and there is pain that may be actually involved in it. So one of the best ways to take care of this is prevention. So prevention through careful observation and skincare and frequent changes in position is extremely important to be able to prevent any pressure ulcers. So what we're looking right here are the pressure ulcer danger zones, okay? So when somebody's lying on their side or a lateral position, then if a person stays there for a long period of time, if they don't have any, or if they have problems with circulation, then what ends up happening is we are actually causing some problems. So that's why we need to be able to turn a client if they are immobile in bed, if they're not able to turn themselves. So on lateral position, the side of the ear, the shoulder, the hip, the greater trochanter, the knees, and the ankles are pressure ulcer danger zones. If you are lying in your stomach, then of course your cheek, the collarbone, the breasts if you're a female, buttocks area, genitals, knees, as well as toes. Now for supine positions, that's the back of the head, the shoulders, the elbows, the abdomen, the sacrum, as well as between the heels of the legs. All right, you remember that pressure ulcer prevention is very important, and prevention includes observation of the skin, frequent position changes, and good skin care. So let's ask this question, what are the 4 stages of pressure ulcers and how do they differ from each other? And we're going to be talking about that, okay? So wound is a type of injury to the skin. So this is the next type of injury are wounds, okay? So they can be either open or closed, okay? So examine and clean with various solutions. So when we actually look at this, we're going to take a look at the wound and we're going to make sure that we sterilize it, that we keep it clean, okay? That we use antiseptic solutions to prevent any growth of bacteria to prevent any infections, okay? So remember, bleeding may need to be stopped. If it's bleeding nonstop, if it's bleeding profusely, wounds needs to be able to make sure that we seal the bleeding, because that is, causing injury, and we don't want to be able to make sure that if there's any open area that we are able to stop the bleeding and seal it right away to keep it clear from bacteria and possible infections. So when we are actually putting a dressing on a wound, we're going to be using dressing, bandages, we may use sutures, or even staples may be needed, or even special strips or glue may be applied as well. So next disorder of the integumentary system would be dermatitis. Okay, so what does dermatitis mean? Anything that you hear itis at the end of a word means inflammation. Okay, so it's an inflammation of the derma, or the skin. So it commonly affects the lower legs and the ankles. It occurs due to fluid buildup under the skin. Normally it happens if somebody has poor circulation. So this is what we call edema. Okay, so there's that swelling in the lower extremities because you have difficulty with your circulation. And what happens is, with that fluid buildup, it can lead to severe skin problems. Some of the early signs to find out if there is dermatitis, once again, inflammation of the skin, will include a rash, scaly red area, and also itching. Other signs include that swelling the legs or ankles. There's that thin tissue-like looking skin. There may be darkening and thickening of the skin at the ankles. Pain may be involved in this. And if any of these symptoms are showing up, we need to make sure that we inform the family members, the doctor if need be, as well as if there's nursing that's involved or skilled nursing, they need to be involved in this as well. Remember, as home health aides, as homemakers, as caregivers, we are the ones that are going to be primary with the client. We're there more often than the skilled nursing team or the therapists or the physicians. So we're first line of defense, and we need to be able to make sure that we inform the right people to be able to provide care for the client. Okay, there may be the need to actually use elastic stockings to promote circulation. And also at the same time is, what does salt do? Salt allows water to be retained. So to be able to lessen retention of fluids, we may put the client in a low sodium diet. All right, moving on, we're now going to talk about musculoskeletal disorders, okay? Muscle, skeletal, bones, okay? So let's talk about some of the disorders, and, let's talk about arthritis, for example. It's a general term that refers to inflammation or swelling of the joints. There's if you look at it, the root word arthro, okay, and then the suffix is itis. So the suffix itis means inflammation. So inflammation or swelling of the joints. Term of inflammation means swelling. Autoimmune illness. It's an illness in which your body's immune system attacks the normal tissue of the body. Okay, so our own body is rejecting tissues in our body. So that is what an autoimmune illness refers to. Osteoarthritis. As people get older, you're going to start hearing a lot of this. Okay, so osteo meaning bone. Okay. So osteoarthritis is a common type of arthritis, usually affects the hips and the knees and joints of the fingers, the thumbs, and the spine. Now what this is, it's also called degenerative arthritis, or DJD, also known as degenerative joint disease. Now rheumatoid arthritis, on the other hand, is a type of arthritis in which the joints becomes inflamed, red, swollen, and can be painful as well, resulting in restrictive movement and possible deformities. So, other facts that we need to know about arthritis. Arthritis is an inflammation of the joints, okay? Arthritis may be caused by aging, injury, or even that autoimmune disease, your rheumatoid arthritis, for example. There are two types of osteoarthritis and rheumatoid arthritis, okay? And also pain and stiffness increase as cold or damp weather occurs. Now, moving on, let's look at the treatments for arthritis. We may be giving the patient or the client aspirin or ibuprofen or any anti-inflammatory medications. There may be the use of heat pads or local application of heat pads, ROMs or range of motion exercises, You have a diet also may be also involved as well with this to be able to provide an assistance with treatment with people that has arthritis. All right, moving on to muscular dystrophy, okay? Muscular dystrophy refers to a number of progressive diseases, okay? And what happens is it causes a variety of physical disabilities due to muscle weakness. Now, muscular dystrophy is actually inherited and can cause that gradual wasting of the muscle and then also may cause weakness and deformity. Now, most of the muscular dystrophy is actually present at birth. So if you are a home health aide, if you're a homemaker or caregiver, and your job is to be able to help with the ADLs and the ROMs exercises, and what does ADLs means? These are activities of daily living. What are the typical activities that a person have to go through every day to survive and live? Range of motion exercises, on the other hand, is a complete different thing. Range of motion, are we making sure we're doing exercise for them to be able to limit the possibility of weakness and disabilities? So, as also remember this, because of physical disabilities, weakness, and deformities, we also need to make sure that we provide skin care and positioning as well. All right, next one is we're going to talk about myotrophic lateral sclerosis, okay, also known as ALS. ALS is that progressive disease that causes muscle atrophy, okay? Muscle atrophy meaning wasting. The muscle is wasting and eventually leads to death. The average time if a person is diagnosed and they have ALS is only 3 to 5 years. Physical disabilities gets worse and eventually that person with ALS has problems breathing. And then eventually they will need a ventilator. And then eventually they're going to be having to be intubated as well. And so once again, home health aides and homemakers and home caregivers needs to provide ADLs, activities of daily livings, range of motion exercises, and also help with skincare and positioning for the client. All right, let's go to the third aspect of possible disorders, and this would be your nervous system disorders, okay? So we're going to talk about a CVA or a TIA. You probably heard this in medical dramas and medical shows, seen in doctors' shows as well. So a CVA is known as cerebrovascular accident. Pretty much, it's that condition that occurs when a blood supply to a part of the brain is cut off suddenly by a clot or a ruptured blood vessel. And what it really is known as, it's pretty much a stroke. The TIA, on the other hand, is that transient ischemic attack. It's that warning sign of a possible cerebrovascular accident that results from a temporary lack of oxygen to a brain, or a mini stroke pretty much. CVA is a stroke, a TIA is a mini stroke. Moving on with other terms, expressive dysphagia, also known as slurred speech or the inability to speak. Receptive aphasia is the inability to understand spoken or written words. When we talk about hemiplegia, that's the paralysis on one side of the body, hemi. Hemiparesis, on the other hand, is weakness on one side of the body. Emotional liability, in regard to nervous system disorders, are laughing or crying without any reason or when it is inappropriate. Dysphagia, on the other hand, is difficulty swallowing. And when we talk about involved, it's a weakened side of the body due to stroke or injury, also called the weaker or the affected side. These are things we need to know when we're talking about disorders in regards to the nervous system. Now, let's talk about CVA a little bit. It's caused when the blood supply to the brain is blocked or a blood vessel leaks or ruptures within the brain. Remember, this is what we call a stroke. When somebody has a stroke, they had a CVA. It results in that lack of oxygen to the tissue, causing cells to die. So the swelling, the leaking blood, and the clots affect the surrounding health of the brain tissue. Now, if somebody has a CVA, we need a quick response to this because it's very critical. Okay, remember, if your brain dies, your body goes with it. Okay, so we talked about the CVA and the TIA. So the TIA is the early warning sign of a CVA. Remember that there's a possible weakness that occurs opposite the affected side of the brain. A mild stroke may result in few, if any, complications, but a major stroke can cause death. So you need to understand your role as that home health aide or the homemaker, the caregiver in the rehabilitation process for a client who has experienced a CVA. We need to be able to help the client work in steps towards simple goals. We need to be able to encourage the use of the weaker side. We need to be able to encourage them to roll onto the strong side first and not the weak side. We need to be able to make sure that we support them. Support that involves shoulder. Like pretty much, let's say for example, the right side's affected. We need to support them on the weak side because that's the one that got affected. Positioning is always important. Okay, we need to be able to make sure we give the care that's needed for them. Also understand we need to remove any possible hazards such as clutter in the floor, because they have difficulty with their balance, with their gait. They may need the use of a cane or a walker as they get better with their therapy. We need to be able to make sure that if we're providing safety transfers and body mechanics for the clients, that's very important as well. We need to pay attention to skin care and also check for harmful situations related to the loss of sensation. So moving on to other nervous system disorders, Parkinson's disease, for example. So what is Parkinson's disease, and do you know anyone who is famous or within your family that has Parkinson's? So one famous person that has Parkinson's is Michael J. Fox. So if you've seen him lately and see the symptoms that occurs with him, other person that's been diagnosed with Parkinson's is Muhammad Ali, and with his position right now. So Parkinson's disease is that progressive, incurable, degenerative disease. What ends up happening is if you have Parkinson's, it causes stiff muscles, stooped postures, shuffling gait. You have that pill rolling, tremors, and those mask-like facial expressions. And then tremors can make ADLs difficult as well because if you're tremoring, you have the pill rolling, your hands are just shaking round and round, it's hard for you to be able to do your basic activities of daily living. So the next one, other than Parkinson's, is multiple sclerosis now. So MS is a progressive disease, unfortunately, and it affects the central nervous system, also known as the CNS. So the protective sheath, in your nervous system breaks down over time, and the nerves cannot send messages properly. So the clients will have varying abilities, Symptoms can include blurred vision, that's one thing, fatigue, tremor, poor balance, trouble walking, weakness, tingling, incontinence, and behavior changes. So your MS can cause blindness as well, contractures and loss of functions in the arms and the legs. So typically if somebody has a multiple sclerosis disorder or a diagnosis, we need to be able to address the care that they need. So moving on, when somebody has a multiple sclerosis, we need to be able to help them. We need to prevent the falls, avoid stressful situations because the stressful situations can actually cause problems for them. We need to make sure that they're given the proper diet. Skincare is very important, especially when they cannot do things for themselves anymore. Also with the range of motion exercises is important. Moving on to other stuff, other diagnosis and other terms that we need to know in the nervous system disorders are paresis, paralysis, paraplegia, and quadriplegia. So let's talk about the meanings for these words. Paresis is that weakness or loss of ability on one side of the body. So when you hear hemiparesis, so one side of the body, a portion of the body. When we hear paralysis, it's the loss of muscle function. Paraplegia, on the other hand, is a loss of function of the lower body and legs. Now, quadriplegia, that is the loss of function of the legs, trunks, and arms as well. Quad meaning four. So moving on, other things that we need to know about injuries of the head and spinal cord. What ends up happening is this may result typically from people diving, sport injuries, falls, car and motorcycle accidents, industrial accidents, war, and we also see a lot lately, especially in Chicago and New York and a lot of the big cities, are criminal violence. And so due to gunshot wounds, for example, we're seeing a lot of those spinal cord injuries. What happens is when you have a spinal cord injury, whether a head or spinal cord injury, we may have brain damage, mental retardation, personality changes, trouble breathing, seizures, coma, memory loss, loss of consciousness, paresis, paralysis as well. So the effects of spinal cord injuries depends on the force or the impact where the spine was injured. So you may become a paraplegic or a quadriplegic. So any of these things, you're going to need rehabilitation. You're going to need emotional support. You're going to need assistance. Okay, we need to be able to be patient with them. We need to prevent falls and possible burns. We need to assist with those position changes, encouraging fluids and proper diet, offer rest periods as needed, as well as use special stockings if it is ordered, okay? We need to be able to provide them great care. And also, if they're paraplegic or quadriplegic, they may not have control of their bowels and bladder. So we need to assist possibly with bowel and bladder training as well. So moving on, let's talk about other problems. And one thing could be hearing impairments. That's also part of the nervous system disorders, okay? So we need to make sure if one of our clients has hearing aids, that when we wake up every day, when we're giving the care, they're wearing their hearing aids. And other than wearing the hearing aids, are they working? Is there battery? Do we need to change it? Okay, it's hard to communicate with them enough with it. Imagine if it's not working. You want to be able to reduce and remove the additional noises or back noises pretty much. You want to get the client's attention. You want to speak clearly, slowly, and in good lighting. And the reason for that is sometimes they would have to look at your mouth and maybe read your lips. Okay? Never ever do not shout or mouth words in an exaggerated way. You have to understand this. If they are hard of hearing and we actually talk louder, it's harder for them to hear. By us actually lowering the pitch of our voice, it is actually better for the client. And also keep hands away from the face while talking, okay? Allow them to be able to see your lips, because some of them are lip readers as well, and it helps them be able to understand better. So here's some other facts about hearing impairment. Sometimes you want to use short sentences, use simple words. Of course, definitely avoid using medical terms. You want to be patient with them and very empathetic. Imagine if you lost your hearing. How would you want people to treat you? I always tell a lot of our clients, I tell a lot of our students that, when you're giving care for the client, imagine that you are them. And imagine how you would want to be treated. Or if your loved one was in their situation, how would you want your loved ones to be treated? We always need to make sure that we are patient and empathetic and very understanding and supportive. The people that we work with are people that are needing our help, and we need to be there for them. Okay, here's more things that we need to know, and we're starting to get into sight, into seeing problems. So farsightedness and nearsightedness. What's the difference? Are you wearing glasses? Do you wear glasses? Do you know somebody that wears glasses? Farsightedness is that ability to see objects in the distance better than objects nearby. And this is what we call hyperopia. Hyper meaning a lot. Pretty much hyper. Hypo is little. Hyper is more. Okay, so nearsightedness. Nearsightedness is that ability to see objects nearby more clearly than objects far away. That's called myopia. Now, cataracts and glaucoma, people get confused with these two. So let's talk about cataracts first. It's that condition in which that milky or that cloudy spots develop in the lens of the eye, causing vision loss. Glaucoma is a condition in which fluid inside the eyeball is unable to drain, which increases pressure inside the eye, causes damage that often leads to blindness. And a lot of clients that have glaucoma is due to the results of diabetes. So more things we need to know about people with vision impairment is that vision impairment can affect people of all ages, unfortunately. Some clients may wear glasses or contacts. Some people are going to need surgery. People over 40 are at risk for developing cataracts, glaucoma, and blindness. Cataracts can be corrected surgically. Glaucoma can occur suddenly or gradually and is treated with medications and sometimes possibly surgery. So when we are providing care, we need to be able to make sure that we address the client because they have vision problems. So you need to identify yourself if you're entering or if you're leaving the room. You want to be able to provide good lighting. You need to be able to orient the client to new areas. Use imaginary clock as a guide. So when we talk about imaginary clock is, let's say you set the food in front of them. You can tell them, you know what? Your water is at 1 o'clock. the meat is at 3 o'clock. Okay, you're going to say the vegetables are at 7 o'clock area, and as well as the starch, the potatoes are on the 11 o'clock side. And you want to be able to detail that so that they are aware of this. You want to be able to make sure you put anything you move back where it was found, and also leave door completely open or closed, because you want them to know it's closed so that they can open it. And if it's open, then it's open. If it's open halfway, you may cause them to hit the corner of that door, and you want to prevent that. So, talking about guidelines for caring for a client with vision impairment, here's more stuff that we need to know. You want to be able to make sure that you walk slightly ahead of the client while he touches your arm. You want to cut the food in open containers as needed. Use large clocks or clocks that chime. Make sure eyeglasses are on, clean, and in good condition. And if you didn't know that, there's clocks out there that actually can talk now, that can tell you the time. So it's even better that way. Even, for example, a lot of diabetic blood sugar machines actually can talk and tell you what your results are now as well. Okay, continue on. We're going to also talk other things, and amputation, phantom sensation, and phantom limb pain. So we're going to talk about people when they are actually missing arms or legs or any of the appendages. So amputation will be the surgical removal of some or all of the body part. Sometimes we're going to have patients that has below the knee amputation, also known as BKA, or, AKA, which is above the knee amputations. And then we're going to move on to phantom sensation. What's a phantom sensation? It's a warmth, itching, or tingling from a body part that has been amputated. The person is going to say something who had his foot amputated. He's going to say, you know what, my foot itches. Can you scratch it for me, please? And you would have to, in their mind, they can feel the itchiness, the tingling. So we're going to have to reorient them and say, you know what, that is a phantom sensation right now because you're feeling that you're itching on your right foot, but your right foot is no longer there. And we need to reorient them to be able to make them see that there is that thing missing. Now, a phantom limb pain, on the other hand, is similar to the sensation, but a phantom limb pain now is pain in a limb or extremity that has been amputated. So we need to be able to know these items when we're caring for somebody with amputation. We need to be supportive. Remember, when they lose a limb, when they lost a part of them, it's like a loss. And typically, people will go through the stages of death, the stages of, of loss. They'll be angry. They'll have grief, until they come to the part of acceptance that they actually lost something. We need to make sure that we actually provide assistance with ADLs, assist with the changes of positions. We want to be able to perform range of motion exercises, and if there's any care plans that's provided and suggestions, we need to make sure that is followed as well. So, moving on, now we're going to talk about confusion. Okay, so what are facts about confusion? When somebody's confused, there is that interference with the ability to make any decisions. If somebody's confused, there may be that personality change. There's going to be anger, depression, irritability are other signs of confusion. Because when, like right now, for example, if you are ever confused and somebody tells you don't remember, it can actually get you irritated a little bit because why are you bringing out the fact that I don't remember? And because if I don't remember it, makes it even worse. I get irritated or I can get kind of pissed or mad. So when somebody has confusion, it can be either temporary. I hope I can say that about myself. Temporary confusion at times, sure. And there's also permanent confusion that can happen as well. And that's a truth too. So when there is confusion for a client, for a patient or whomever we're caring for, you don't want to leave the client alone. You want to be the person that stays calm. Okay? Provide a quiet environment. When you start noticing that there's confusion, you want to be able to speak clearly, speak slowly, speak with that lower tone, okay? And if there's that episode of confusion, you want to introduce yourself each time you see the client. And you also want to try to reorient the client to the location, the name, and the date, okay? So typically as a nurse, when we are actually assessing a patient, we ask for and see at their orientation. We ask them if they can tell us their name. We'll ask them if they can tell us where they are, and we're also going to ask them if they know the date. Now, other guidelines on care for somebody with confusion is you need to be able to make sure you explain what you're going to do using simple instructions. Do not rush the clients in doing things. You want to be able to talk about the plan of the care for the day, and you may have to repeat that again. Okay? You want to encourage the use of the eyeglasses and hearing aids because that may be adding to the part of confusion. They may forget, they can't see, they cannot hear. All right? You want to be able to encourage and promote the self-care and independence of the client. And if there's anything necessary to actually report the observations to your supervisor. So we talked about confusion. Now we're going to talk about delirium. Okay, so the causes includes infection, disease, fluid imbalance, poor nutrition, drugs, and alcohol. Typically, as seniors, for older people, they may be alert and oriented times three. Times time, place, and self. And then all of a sudden, the very next day, they all of a sudden have a total delirium. They don't remember a thing. They don't know what's going on. They have that increased confusion. And typically, if somebody has that, the first thing we'll look into is a possible infection, a UTI, that may actually have happened. When we see any big, large changes going on for clients, we need to report this automatically. If you're a homemaker, a caregiver, you need to report that to your supervisor, your manager, and also that should be then turned and told to the patient's family members, and maybe their physician later on. If you are a home health aide working for a skilled nursing home health agency, then you have to report that to your charge nurse, okay? Very important to be able to say that as well. Now, let's look about two terms, cognition and cognitive impairment. Cognition is the ability to think logically and clearly. Cognitive impairment, on the other hand, is the loss of the ability to think logically. Concentration and memory can and is affected. Now, you always want to remember that normal changes of aging that take place in the brain do not include dementia. Just because you're getting older, that doesn't mean dementia is going to happen for you. That is something that people think, that when you get old, I'm going to get dementia. Not always, okay? It is not part of the normal changes of people getting older. So let's talk about and understand some of the normal changes of aging, okay? There may be some loss of cognition, affecting some of your memory, concentration part may be affected a little bit, but not dementia, okay? You may have a slower reaction time. So, you actually start seeing that, like, for example, athletes, as they get older, they have slower reaction times, right? So that's why they start talking about athletes as they get older, they have slower reaction times. So they can't pitch as good. They can't catch as good. They can't shoot as good. They can't run as good. There's just a slower reaction time as we get older. And of course, as the age adds up, the reaction time also slows up as well. There may be the difficulty finding or using the right words. There may be the sleep problems, and so they may sleep less and be more awake all the time. So in nursing homes, for example, or hospitals, senior clients, they may be awake really, really early, but slept really, really late. Okay, so what is your role as a home health aide in dealing with normal loss of concentration of memory in the elderly client? Think about that. What do you think is the part of your role? What do you have to do to be there and provide assistance? All right. Encouraging your client to make lists of supportive ways to help them address normal loss of memory and concentration is important. What do you need to do to provide assistance with memory loss? Do you need to provide to-do lists for the clients in the refrigerators? Do you need to be able to give them reminders on a daily basis? For medications especially, we need to make sure that they're reminded. So that's why typically some homemaker companies are having, daily medication reminder programs that make sure that clients are taking their medications. Because if they don't take the medications, that's one of the biggest reasons of clients at home having to go to the hospital and being admitted, is non-compliance with their medications. So moving on to dementia. Dementia is a general term that refers to a serious progressive loss of mental abilities, such as thinking, remembering, reasoning, and especially in communicating as well. Now, some of the most common dementia disease out there is Alzheimer's disease, a multi-infarct or vascular dementia, meaning that a patient or a client had a series of strokes, and because of those strokes, it pretty much made damages to the brain, and because of that, dementia occurs, and there's that problem that occurs. You have your Lewy body's disease. The Parkinson's disease also can add to dementia as well. And talking about Parkinson's, it can also increase, okay, depression that's added to this, because this is a problem. So one typical person that we want to talk about in regards to Parkinson's is Robin Williams. If you guys didn't know, he committed suicide. But one of the reasons that caused his depression to get increased is his recent diagnosis of Parkinson's disease. Another disease that may cause dementia is Huntington's disease. So let's talk about Alzheimer's disease. It's a progressive, incurable disease that causes tangled nerve fibers, as well as the protein deposits, to form in the brain, which eventually causes the dementia. Progressive, the term progressive means something that continually gets worse or deteriorates. So there's a progress going on. When we typically hear progress, we're thinking good, positive things. But when something is progressive, if it's a disease that's progressive, that means it's continually getting worse and deteriorates. Degenerative, on the other hand, is something that continually gets worse as well. And irreversible is unable to reverse or return to its original state. So if it's a disease, it's an irreversible degenerative disease. It's something that's going to continually get worse, yet you cannot change things and make it better and have it go back to its normal self. All right? So talking about Alzheimer's, we have to make sure that this is talked about, because a lot of clients that we're seeing do have Alzheimer's disease. And if you haven't seen around yet, there's those Alzheimer's associations that you can actually join. There's the Alzheimer's walk to increase the awareness of Alzheimer's. So AD, or Alzheimer's disease, is progressive. Okay, so it's continuously growing. It's continuously happening. Okay, once it's there, it's going to happen. It's degenerative and irreversible. Okay, so once it starts occurring, we cannot have it go back to its normal self. So remember, we talked about what it was. It's that tangled nerve fibers and the protein deposits, that starts causing problems as well as reactions in the brain. So when somebody has Alzheimer's, they may need progressive care. They need to be able to have care going on. So we need to be able to make sure that we address that to the client when they have Alzheimer's, and also be able to address any questions that patients' families may have as well. So let's talk about some of the stages of Alzheimer's disease and how does it differ from the stage which precedes it. Okay, so we need to be able to look into it. And I truly encourage you guys to actually go to some of the websites out there, like Alzheimer's diseases. There's so many information out there right now. And we want to be able to know all the different things that's going to be expected with a client that has AD. So every victim progresses differently. Okay, not everybody can be calculated, say, okay, they have this, so within 3 months they're going to have that. Every patient, every client has different progressions. Okay, so Alzheimer's disease clients should be encouraged to do self-care and keep their minds and bodies active for as long as possible. We want to actually encourage them to keep doing care for themselves. So when somebody has Alzheimer's, okay, we need to look at the attitudes that we have for that. We want to make sure that they don't, or their family does not take it personally. If we're caring for them, we want to be able, once again, put ourselves in their shoes. How would I want to be treated if I had Alzheimer's? We want to be able to work as a team, okay, and then work with the family, work with the client, work with all the caregivers, the physicians, to have that support that needs to be given to that client, to that patient. Okay, we want to be able to make sure that we approach them from the front so we don't scare them. Okay, as dementia grows and as they have problems understanding, we want to be able to speak slowly, lower tone of the voice, always make sure we repeat ourselves if we need it. We want to be able to, if they have problems being able to actually converse with you and gesture with you, we need to be able to use signs, pictures, gestures, or written words to be able to help with communication. Okay, what happens if they become frightened or anxious? If that ever happens, you, once again, try to keep him calm. You need to be calm for them to be calm. Okay, we talked about when we're conversing with them, we're having communication, always talk in a low, calm voice. All right, we need to use those simple words and short sentences so it's easier to communicate with them and repeat things. We need to be that calm person to provide calm care. All right, now look at the general principles now when providing care for them. You want to develop that routine. Once again, to promote self care. And you need to take good care of yourself. For you to care for somebody that needs this much care later on, you need to care for yourself, and this needs to be encouraged also for the client's family members because they're going to be there, more than you are typically at times. Other things that happens when clients has Alzheimer's is, chance of infections. So we want to prevent infection. We want to observe physical health. We want us to watch signs of pain because they may not be able to explain to us that they're experiencing pain. So are they grimacing when we actually move them, or are they making facial expressions that show pain? Remember, we need to be able to encourage self-care, but also at the same time as provide daily exercises or range of motions if they can't do it for themselves, or if they can, encourage them to do that. Always, add positive behaviors such as smiles, hugs, warm touches, and thank yous to them. Okay, moving on a little bit with a couple more diagnoses is agitation and triggers. So agitated. Have you ever been agitated in your life? I'm sure you have been. Who caused the agitation? But let's talk about what does agitated means. It's a state of being excited, restless, or troubled. Triggers is a situation that leads to agitation. So what's the triggers? Who triggered you to be agitated one time? Was it your kids? Was it your husband? Was it your boyfriend? Was it your wife? What are your triggers? Okay? And we need to know these triggers so to prevent agitation, of course. Now, sundowning, catastrophic reaction. Sundowning is that condition which a person gets restless and agitated in the late afternoon, evenings, or nights. So nobody really fully knows what's the reason of sundowning. Some people say, it's the moon that causes it, because there's that gravity pull that happens, or it's the low tide or the high tide or whatever. But that's pretty much what they say about sundownings. Now, catastrophic reaction, on the other hand, is the reacting to something in an unreasonable, exaggerated way. Like you're over exaggerating things. Like, somebody drops water, then all of a sudden the person just goes crazy and they say, oh my, the water, the waste, and just starts going and having unreasonable, agitative response to it because it's a catastrophic reaction. Anything negative or anything bad that happens, they take it to that next level of a reaction. Okay, moving on. Violent pacing, wandering, and elopes. So when people start having confusion and dementia, this may also happen, or if somebody has psychological problems as well, this unfortunately may occur. So violent is that word that describes the action that includes attacking, hitting, or threatening someone. First of all, we can ever be violent towards a patient or a client, but it also goes the same exact way of them to us. Okay, as a caregiver, okay, we need to be understanding that things may occur, but also make sure that we report things that are happening. Pacing is walking back and forth in the same area. So typically, some patients with Alzheimer's or dementia may be seen pacing back and forth, sometimes typically even at nighttime. Wandering, if somebody walks aimlessly around the house or the neighborhood. When somebody has a dementia or one of those confusion reactions or episodes of confusions, they may leave the house, which can also cause problems and a problematic thing where somebody can get injured. Elopes, under medicine, under the medical practice, is when a person with Alzheimer's disease wanders away from a protected area and does not return on his own. So it's almost part of wandering, but this is when they actually really go away and they cannot come back or know how to come back. So a lot of people with dementia, confusion, and Alzheimer's nowadays, especially in the home care setting, we give them those electronic monitoring devices that goes in their shoe, or they have those emergency buttons for emergencies as well, but also doubles up as a tracking device so we know where they are. Now, moving on, you have hallucinations, delusions, perseverating, and also repetitive phrasing. Hallucination is being able to see, hear, smell, taste, and feeling things that are not even there. It doesn't exist. Delusions, on the other hand, is believing things that are not true. Okay, so that's the difference between hallucination. Hallucination, you're seeing, hearing, smelling, tasting, feeling things that are not there. Delusion is believing things that are not true. Okay, what you see is not really true. When we talk about perseverating, it's repeating words, phrases, questions, or even actions. Repetitive phrasing, on the other hand, is repeating words, phrases, or questions. Pillaging, all right, that's taking others that belongs to someone else, not considered stealing. So it's more of a diagnosis where somebody cannot really stop what they're doing. It's really a disorder, okay? So, kleptomaniacs, for example, is almost right there at that level, but it's still bad. But when somebody's pillaging, it's taking things that belong to someone else, not considered stealing at all, if it is a proven diagnosis. Hoarding, on the other hand, if you've ever seen those shows, the house hoarding, I think is one of these shows out there where what happens is people are collecting and putting things away in a guarded way, like they're collecting magazines, and if you look in their house, you can barely walk around because there's magazines stacked all the way to the roof. Or you've probably seen cars that are full of stuff to the brim. You can't even see in the back or even the side no more because it's full of so much stuff. So this is examples of hoarding. So we need to be able to know, things, when there's these type of difficulties and problems. So, but here's some points that, about safe environments for clients that has Alzheimer's or dementia or any of these other forms. As a nurse or as a home health aide, as a homemaker, we need to always assess for safety for that client, for that patient. Because remember, if it's an unsafe home and we actually work there as well, then it's an unsafe work environment. And we need to be able to have a great, healthy, zone-free, pretty much accident or environment safety-free, or not safety-free, but a safe environment to work into. So we need to be able to make sure that suggested safety measures are actually implemented, are in place. We need to be able to make sure that any changes in the client, especially behavior, must be reported. And this is just very important. We need to have a safe home environment. So other things we need to talk about is, we need to use signs to mark rooms, including stop signs on rooms that should not be entered. So if we need to do that because the dementia is so great, the confusion is so high that we need to put these reminders. The stop signs have helped and has shown help. In a lot of nursing homes, for example, we've even seen that what they would do is they would put a line on areas on the floor that they don't want somebody to cross. So they'll put a staggered line or a tape in the floor, and it actually prevents people from crossing it. Okay, so when somebody has dementia or confusion going on. Other things that we need to do is make sure that we provide pictures and familiar objects around, and some of the photos of the family members actually put the name of the people there. If this is your Aunt Jude, put Aunt Jude on there if that's what they know them as. Try to be able to get them to be orientated back to their normal self. Okay? Moving on, for clients that wanders, we want to unfortunately use lock on doors to prevent them from having to leave if need be. These can be installed lower or higher than usual so the client will not see them. Install alarms as needed. Make sure that the clients are always wearing medical identification bracelets as well. Some of the clothes should be labeled. Maybe your neighbors should be also informed just in case they see, your client or your loved ones wandering, okay? Or also known eloping. Remember we talked about those emergency response buttons that can actually track the location as long as they're wearing them. They also have those items in bracelets as well as the shoes. Now for clients that are pacing or pacers, we want to make sure we remove the clutter and the throw rugs because that would actually reduce the chance of any falls. Never rearrange furnitures. Just keep it the way they know it as. Prevent from waxing the floor so it's not slippery. Make sure whoever these are, the patients, the clients, are wearing shoes and slippers that fit and that the soles are non-slip as well to prevent any slips or injuries. Now, if a client has difficulty walking, on the other hand, make sure the areas are lit. Block access to the stairs with the gate, of course, because you don't want them walking in the stairs and having them cause to have any falls down there. We want to be able to clear any walkways of electrical cords and any clutters as well is very important. So here's more additional general tips we should know. We want to keep medications and other chemicals out of reach. Okay? Post emergency numbers, including poison control and home addresses near the phone. Because remember, if you have confusion, if you have dementia, there may be problems that starts occurring and they may accidentally poison themselves. Almost think about it as that, little kids, little children, little infants. We don't want them, because if they don't know what it is no more, that they may cause injury to themselves. Okay, here's an initial question I want you to think about. All right, at which stage of Alzheimer's disease would each of these therapies be useful? What are the benefits of creative therapies? So we talked about some creative therapies to be able to help them, and do you see why that's very important to be able to provide that? Also, lately, there's been a lot of different treatments out there for Alzheimer's, and it's not saying going to treat it, but it's more likely slowing things down a little bit. So you have your Ashby memory method, where they actually, for example, look at Alzheimer's disease as actually a traumatic brain disorder or brain accident. So they treat, Alzheimer's clients just like they would treat somebody who had a brain injury. So what other adjustments that family members may have to make when a loved one has Alzheimer's? So let's say, for example, you have a uncle who has Alzheimer's disease. What kind of adjustments can the whole family as a whole actually do in order to be able, to adjust? Also we need to look at also as well as the financial resources or the lack resources of. Be able to understand that when somebody has to go through this, that unfortunately there may be someone that has to look at the financial problems, the financial resources that they're going to have to look into to be able to get them the care that is needed. Not everybody can be there full time. So what are the choices needed? And so that's why home health is such an important part. That's why homemaker non-medical caregivers are important as well, to be able to decrease the cost, because it costs more if a client ends up in a hospital, ends up in a nursing home, whereas we can keep them at home would be a lot better. And that would just work so much for the client. So what are sources that we can look to get some information? And remember, I told you guys that, we shared with you guys a lot of information about Alzheimer's disease and how you can actually really know more. And it's very good to be able to be aware, because in the home health industry, in the non-medical private duty industry, a lot of our clients that we're going to end up dealing with are with Alzheimer's or dementia. And it should be an important thing for us to know. So places to go to be able to get more information is the Alzheimer's Association. They have the Alzheimer's Walk on a yearly basis. Participate in those. It's very important. You can get information at the National Institute of Aging. There's the counseling places, support groups, and healthcare professionals. They're all over the internet, and I do and truly suggest that you look into that even further. Moving on, let's talk about common circulatory disorders. Okay, we talked about neurological disorders, musculoskeletal disorders, integumentary disorders. Now we're in the circulatory disorders, pretty much relating to the heart and your circulatory systems. Okay, so we're going to talk about hypertension. Okay. So when somebody has hypertension, that means they have high blood. So problems that happens are atherosclerosis, kidney disease, adrenal tumors. There may be part of pregnancy as well. If a person is pregnant, they may get hypertensive. Parts of hypertension, you may have headache, blurred vision, dizziness may occur. Don't forget, as well as, some of the treatments to give and to do for hypertensive clients are diuretics. Those are like your Lasix medications. Increase exercise and range of motions, and at the same time is lowering your fat and low sodium diet, because when you're hypertensive, maybe by being able to decrease the amount of fluid being actually kept in your system may lower your blood pressure. Now you have coronary artery disease, which is your vessels in your coronary arteries narrow, so they get really, really narrow. So what happens is it reduces the blood flow to your heart. And when there's a reduction in blood flow to your heart, that's a reduction of oxygen, okay? So what happens when somebody has a coronary artery disease? Angina pectoris, also known as chest pain or discomfort, okay, may result. And some of the best ways to treat that is rest, nitroglycerin, whether it's a sublingual nitroglycerin or a patch nitroglycerin as well. Avoid overeating, overexertion, and extreme weather exposure. So when talking about avoid overeating, it's very important to do that. Now, myocardial infarction is a block of blood flow to the heart muscle, okay? MI. So severe pain in the chest happens, discomfort, indigestion, nausea, vomiting, dyspnea, dizziness, cyanosis, perspiration, you have the cold and clammy skin, somebody gets weak, irregular pulse happens, low blood pressure occurs, increased anxiety, that sense of, impending doom. And the denial also happens, okay? So when we talk about an MI, we're really talking about a heart attack, okay? So if somebody has a heart attack, there may be that immediate emergency care that's needed, CPR, cardiopulmonary resuscitation. You need to have your exercise, the low fat, low sodium diet is needed, medications is needed, be able to make sure that the smoke, they quit smoking. Stress management is needed and avoiding cold temperatures because cold temperatures can cause problems and increase the chances of a myocardial infarction or also known as a heart attack. Other circulatory disorders is your CHF, also known as congestive heart failure. So this is where your heart muscles fail to pump well due to possible damage that occurs to it. So when your heart muscle is not able to pump fully and have problems doing that, you may end up having fluid retention in your muscle area. And what happens is you may get, increased chances of dizziness, coughing, dyspnea, difficulty breathing, confusion, fainting, cyanosis, meaning bluish, turning blue because of the lack of oxygen, low blood pressure, edema happens because you're retaining fluid, okay? So you may have that weight gain that's added to that because you're retaining the fluids. So when we're caring for somebody with a CHF, we want to be able to make sure they're given medications. There's that fluid reduction that happens. We're going to start monitoring their eyes and nose, meaning the intake and the output, making sure that what they're taking in, or it's actually leaving them and they're not retaining things. We're going to start, measuring their weight possibly on a daily basis. Are they increasing their weight by 5 pounds within a matter of 1 day? Is that normal? No, it's not normal. So we need to take a look at that. Is that fluid being retained? Do we need to give elastic stockings to assist with the edema or the swelling in the lower extremities? We need to be able to increase the range of motions, make sure that exercise is being given, okay? And if need be, do we need to add extra pillows? And the reason for the extra pillows is, do we need to elevate the patient's legs when they're laying down to be able to help with gravity to bring the fluid back up? Because what happens is when you have congestive heart failure, your heart muscles is not pumping well enough. So you have problems getting fluids to come back up from your lower extremities. And that's what causes that edema or that swelling of your lower extremities. All right. Let's look at a lot of more terms, and one of them is hypertension. We talked about this earlier on. Hypertension is the high blood pressure, typically meaning your blood pressure is measuring above 140 over 90. Okay, your systolic and your diastolic, 140 over 90 or even higher. When we talk about pre-hypertension, that's a condition in which a person has a systolic measurement of 120 to 139 and a diastolic, which is the lower number, between 80 to 89. So what happens is an indicator that that person does not have high blood pressure now, but more likely it is coming. Now, atherosclerosis is hardening or the narrowing of the blood vessels. When we talk about diuretics, this is the type of medications we give, like Lasix, for example. It's a medication that reduces the fluid volume in the body. So let's know some facts about hypertension. What causes it? Well, atherosclerosis causes it. Adrenal tumors can cause it. Pregnancy can cause it. Kidney disease can cause it. Diabetes can cause it. Some of the symptoms that happens when you have high blood pressure is headache, blurred vision, and dizziness. Those are some of the primary ones. Once again, headaches, blurred vision, and dizziness. When we're caring for them is diuretics, exercise, low-fat, low-sodium diet is also important as well. So moving on, we talked about these two earlier on. Angina pectoris, also known as chest pain or pressure or discomfort, sometimes can get mixed up with indigestion, okay? Now, nitroglycerin, on the other hand, is a medication that relaxes the wall of the coronary arteries, allowing pretty much your arteries and your blood vessels to actually open up more, which then increases, okay, increases that flow, okay? So when you are given nitroglycerin, if it comes in sublingual tablets, what's going to end up happening is your blood vessels will dilate, and now you have oxygen coming or flowing through. And other than tablets, it also comes as a patch, and nowadays a spray as well. All right, we also talked about coronary artery disease also. What it's about? The cause is your vessels of the coronary arteries narrows down, okay? So once again, if it narrows, it reduces the blood to the heart. So if the reduction to blood to the heart, that means there's a reduction in oxygen. So what are the symptoms? Angina pectoris or chest pains. Remember, weather is very important. Try to stay away from the cold. All right, try to avoid overeating, overexertion, and then also make sure that you have lots of rest, and most likely nitroglycerin as a treatment. So let's know some more facts about myocardial infarction, also known as a heart attack. So that's the block of blood flow to the heart muscles. What are the symptoms? We talked about this earlier also. Sudden severe pain in the chest, pain or discomfort, feeling of indigestions, and so forth. The care is important. Immediate emergency care may be needed, as well as CPR, okay? But before that ends up happening, if we can prevent it, we need to be able to have the low-fat, low-sodium diet. Make sure medications are being used to regulate the BP or the blood pressure, or also the heart rate as well, okay? Moving on to congestive heart failure, we're repeating this again. And why do we repeat it? Because it's important, okay? So failure of the heart muscles to pump due to damage, or you have that increase in weight possibly because of fluid retention. So that's why we're treating the person with low sodium to avoid retention of fluid, making sure that they're given medications like Lasix, pretty much your diuretics, to reduce any fluid buildup, extra pillows to raise the feet up to make sure to help with the flow, to provide alleviation to the edema on the lower extremities. All right. Now we're going to talk about respiratory systems. We talked about circulatory in the last sets. Now we're going respiratory, or pretty much your lungs, your breathing, those type of problems. Typically, a lot of patients that we're going to be dealing with when it comes to adults and seniors are dealing with a lot of respiratory and a lot of cardiac issues, okay? So when we talk about COPD, and I'm sure you've heard this before, COPD is actually known as the chronic obstructive pulmonary disease. Very long word, so we kind of like to shorten it up by just saying COPD to it, okay? So what it is, it's a chronic. So what's chronic? It's long lasting. It's been occurring for a long period of time, because earlier on in this section we talked about chronic and acute, okay? Acute is a recent right there and then. Chronic is something that has been going on for a long period of time. So COPD is a chronic, incurable lung disease that causes difficulty in breathing, okay? So remember, it's a chronic disease. Lung disease that is grouped right under COPD is chronic bronchitis. So itis, what does that mean? Inflation, that's right. So inflation of your bronchioles, okay? So chronic bronchitis is technically under a category of COPD. Emphysema is also a second lung disease that is grouped under COPD. All right, so what happens is if somebody has COPD, there's a high risk of lung infections, okay? So symptoms that includes your chronic cough or wheezing, difficulty breathing, shortness of breath, pale or cyanotic skin, or that reddish purple skin right in the face. You may have increased confusion because of that reduction of oxygen. There's that increased weakness. There's that difficulty completing the meals, because when you're eating, right, here you are eating, it's harder to breathe because you're chewing and doing everything at once. And also because of having problems with the breathing, that can cause fear, that can cause anxiety for someone, okay? Now, remember, when your client with COPD or chronic obstructive pulmonary disease, they may live with a constant fear of not being able to breathe, okay? They may fear suffocation, so we need to encourage them and be there for them as needed, okay? All right, observe and report symptoms when they are getting worse. That is a must. We need to make sure that we report that, okay? And then always help the client sit upright because their breathing gets better if they can actually sit upright. That's most and very important to know. All right. We need to offer plenty of fluids and small, frequent meals. Encourage a well-balanced diet. Keep the oxygen supply always available. Remain calm and supportive. Use proper infection prevention practices. You need to encourage their independence. Any of these seniors that we have and that we work with, we always want to encourage independence for them. We want to be able to remind the clients to avoid any exposure to any infection. Encourage pursed lips breathing as well. Okay? And then if there's any of these symptoms that occur, we need to report that right away. A temperature of above 101. Is there any changes in their breathing pattern? If there are any changes in colors or consistency of any lung secretions, their phlegm, for example. Are there any changes in the mental state or personality? Because if there's any changes in the mental state of personality, maybe that may be a cause of lack of oxygen, okay? So also if they're not taking their medications, that needs to be known as well, because if they're not taking their medications, let's say, for example, they're not taking their they don't want their nitroglycerin patches, or let's say they're using Lasix, for example, okay? If they're not using their Lasix to reduce any fluid buildup, if they have CHF and COPD at once. But let's say, for example, we're just talking about the COPD. What if they're not taking their breathing treatments, okay? And that's going to cause problems. What if they don't want to use the oxygen and that's ordered, okay? We need to also make sure that we always look at these things, and it's very important. And always make sure you increase their dependence. Okay, increase their independence. We want to be able to say, hey, we need you to do things for yourself. We need you to do self-care. Okay, because if they're going to be needing more help, increasing dependence in our services, then there is that slowly, breakdown that's going on, that they're starting to need more care and more help. And what do we need to do? So that's why we need to encourage and make sure that they actually do a lot of self-care and they can do things for themselves. Okay. Moving on, we're going to now talk about disorders in regard to the urinary system, and that is also very important to know. So note facts about urinary incontinence, okay? So what is urinary incontinence? Incontinence is not a normal part of aging, okay? And when somebody has urinary incontinence, let's say, for example, they're having urinary accidents in themselves, it may be a cause or a sign of another illness, okay? And also remember, if somebody is having incontinence, it's also a major risk for pressure sores, okay? Because your urine, if they're urinating on themselves at nighttime, the urine actually is acidic and can cause breakdown in the skin. Think about a kid, of a baby, that wears diapers, right? So they have diaper rash. Why does the rash happen? Because of the urine. The urine is acidic and actually touching the skin for long periods of time without cleaning it or being able to put any powder or whatever needs to be placed in there to be able to provide a barrier, as we may say, can cause a breakdown on that particular skin. So when somebody has urinary incontinence, typically happens to people who are confined to bed, who are ill, who are elderly, paralyzed, or who have a circulatory or nervous system disease or even injuries. So we need to be able to address any urinary incontinence. At the same time, as if somebody is incontinent, we need to offer, continual assisting with toileting as often as possible. Have a toileting schedule is very important. If they have any requests, we need to answer those promptly. We need to document carefully and accurately any time a client's skin or anything touching a client's skin is wet from urine, even if it's just a small amount. You want to be able to make sure the client's washed completely. We want to be able to make sure avoid any skin breakdown. If there's any wet incontinence briefs or pads, we need to promptly remove that and change it right away. And never, ever, ever call it diapers. Okay, diapers are for kids. Those are for babies. They're not for adults. So their incontinence briefs, those are the way we actually talk about that, okay? We need to be able to make sure that we're actually reassuring, we're understanding, and we're professional when we are providing care and assistance. All right, so let's now move on to the gastrointestinal system. We're moving away from the urinary tract, so we're now with the gastrointestinal system. Now we're going to talk about constipation. Some of the main causes of constipation is that decreased fluid intake, okay, poor diet, inactivity, medication, aging, disease, or even ignoring the urge to eliminate, okay? Why is there a decreased fluid intake? Some patients have urinary incontinence, or because they're taking Lasix, they're constantly going to the bathroom to go urinate. And what ends up happening is they tell them, so I don't want to, I always have to go to the bathroom, so I'm not going to drink any more water, or I'm going to reduce my water intake. Well, when you do that, then you start having problems, because if you're not drinking enough water to sustain your system, sustain your body's going to make sure it reabsorbs all the fluids, and so it reabsorbs all the fluids in your gastrointestinal system and brings it back to the body and recycles that. Well, then you're going to have harder stools, which then causes constipation. Okay, so when somebody has constipation, some of the major symptoms that occurs are abdominal swelling, gas, irritability. Okay, have you ever been constipated before and you cannot go? Trust me, you're going to be irritable. Okay, and at the same time how do we know? There's no recent record of any bowel movements. So some of the main treatments are increasing the fluid intake and also increasing fiber intake as well. Increasing possibility of making sure that the person is more active. And if need be, it gets to the point, then a possible enema or even a suppository is due. So when we start talking about fiber intake may need to be increased, we want to be able to make sure that we add that to the diet. Okay, the fluid is very important as well. And then always make sure that those exercises are always given. And then privacy. Privacy is always need to be given to the client as well. All right. Moving on to the endocrine system, the disorders and related care guidelines when it comes to somebody that has problems with endocrine system. So one thing, let's talk about diabetes. What's diabetes? It's that condition in which the pancreas does not produce enough or properly use insulin, okay? So insulin, on the other hand, is that hormone that converts glucose into energy for the body. And then glucose, natural sugar. Okay, so if your hormone cannot convert the glucose into energy, well, guess what? The glucose sticks around. And when the glucose sticks around, well, that's diabetes. So we talked about pre-hypertension earlier on today. Now we're going to talk about pre-diabetes. So pre-diabetes is that condition that occurs when a person's blood glucose levels are above normal but not high enough for a diagnosis of a type 2 diabetes. Gestational diabetes, on the other hand, okay, is a condition in which pregnant women who have never had diabetes before develop high blood sugar, okay? So what happens is they end up become diabetics because and during pregnancies. Now, we need to know some of the facts about diabetes. So the pancreas does not produce enough or properly use insulin no more. Your glucose collects in the blood, causing circulatory problems, because just think about it. Think about a high sugar concentrated fluid. What does it look like? So if we talk about, let's say, for example, maple syrup or sugar water, it becomes thicker, right? So if your blood thickens because of the glucose, you have problems with the circulation of it. So just think about that in that sense. So now there's two major types of diabetes. That's type 1 and type 2. So, but there's also that prediabetes and gestational diabetes. But the two major types are type 1 and type 2. All right? So some of the most, signs of diabetes that we'll see is that poly. Poly means multiple or a lot. So polyphagia, all right, extreme hunger, polyuria, extreme or frequent urination, polydipsia, excessive thirst, okay? But also at the same time as there's that increased weight loss and elevated levels of blood sugar as well. Those are the signs of the diabetes. But the three polys is the most important thing that you're going to hear a lot of. So when we start talking about other signs of diabetes, there's glucose in the urine, okay? Sudden vision changes starts happening. Because remember, we talked about glaucoma, increased fluids in the eyes, okay? Then you also have the tingling or numbness of the hands or the feet. You may have the feeling of being tired. Because remember, you're not converting, your hormone is not converting glucose to energy no more, okay? So if you cannot convert glucose into energy, then you won't have any energy to do, okay? Then you also start having the very dry skin. And then a lot of sores starts healing slowly, okay? Because remember, your blood circulation is thick, right? So it's harder for you to be able to, circulate oxygen to your extremities especially. And also increased chances of infection. So now let's start understanding the more complication of diabetes. So remember that changes in the circulatory system can cause a heart attack, can cause a stroke, poor extremity circulation, okay? Poor wound healing and kidney and nerve damages can happen. Damage to eyes causes the blindness as well. All right? Diabetes can lead to leg and foot ulcers, infected wounds, and gangrene. Then eventually, even possibly, you would have to get amputation as well. You also need to understand that insulin reaction and diabetic ketoacidosis are also serious complications that can occur. So let's talk about the reaction to insulin, all right, or hypoglycemia, all right? The cause is too much insulin. If we give too much insulin or not enough food after we give, let's say, the standard dose of insulin, or too much exercises, vomiting and diarrhea, all right, these are things that can cause hypoglycemia now. So symptoms of hypoglycemia, of low blood sugar, is hunger, weakness, rapid pulse, headache, low blood pressure, perspiration, cold, clammy skin, confusion, trembling, nervousness, blurred vision, numbness of lips and tongue, and unconsciousness. So if somebody becomes hypoglycemic, right, opposite of hyperglycemia or the diabetes, then there's also problems that can actually occur, okay? So when we talk about hyperglycemia or diabetic ketoacidosis, the cause is too little insulin. So the blood sugar now goes too high. So this also happens when somebody is not diagnosed early of diabetes. All right, if a person doesn't go, it goes through and doesn't take the insulin, or not even enough, or not enough exercise, or physical or emotional stress can occur. The symptoms on hyperglycemia, on the other hand, is different. Also increase in thirst or urination. So remember, that's your, polyuria right there, okay? And then increase in hunger, that's polyphagia. There's that weakness, rapid, the weak pulse, the headache, the low blood pressure, dry skin, okay? So these are literally the same symptoms of diabetes, because it is diabetes. You're not controlling the diabetes at all, because the blood sugar is just going haywire and it's just really high. All right, so if somebody has diabetes, we need to follow the dietary instruction that's needed for them, or that's been suggested by a nutritionist, okay? And if you are diabetic and you have not seen a nutritionist, you need to make sure you see that nutritionist. Now, the nutritionist is not going to come in and all of a sudden just change everything about you and remove that and take that. They'll take your normal habits and see how they can kind of make things a little bit better. All right, and if you're diabetic, you want to be able to have an exercise program. You want to be able to lose weight if need be. You want to be able to perform urine and blood tests as directed. Previously, long time ago, we used to do urine testing to be able to, check for your blood sugar levels. Nowadays, we just need a small pinprick of blood in your, either your fingers or your toes, need be wherever, just to be able to get your blood sugar levels. We need to be able to make sure that you perform foot care all the time. When's the last time that you actually look at the bottom of your feet? So if you're diabetic, or you have taken care of a client with diabetes, we need to look at the bottom of their feet at least every other day when we're doing our assessments, because typically, because they have lack of feeling, feeling of pain in their lower extremities, they may actually have an open wound and it may be infected as well. So we need to make sure we look into those things. Also understand that if somebody has diabetes, we need to also make sure we watch out what we're doing when we're doing nail care for them on their lower extremities. And we also make sure that any of these following signs or symptoms needs to be reported immediately, okay? If they have any breakdown, any change in appetite, weight changes, increase or decrease urine output, if there's that change in that mental status, visual changes especially, as well as changes in mobility or even sensation, those are things that needs to be reported to the family, to your supervisor, or to the physician eventually. So let's talk about providing foot care for a diabetic client, because we have to provide foot care, okay? We want to be able to make sure that when you're providing foot care, you wash your hands. Those are always important. Every time you start some care to a client, some contact, hand washing is always going to be always important, okay? Always speak clearly to them. Always make sure you provide privacy for them. And this is just a basic talk of how to be able to provide that foot care. You have that basin halfway with warm water. Never make it hot, because remember their feelings and everything like that in their feet and their extremities can be actually low, and they cannot detect if they're being burnt or not. So that's why we want to be able to make sure that we use warm water, okay? Never ever make it hot water at all. And you can always adjust it necessary as well. Make sure, once again, you're wearing fresh gloves after you've done a lot of the stuff, and you provide the care. You want to make sure when you're rinsing the feet, you rinse the entire foot, including between the toes. And the reason why also, especially when we say between the toes, is that's how you're doing your assessment. You need to look at everything, bottom of the foot, between the toes, because there may be some breakdown there as well that we need to look into. And then when we actually are wiping the foot, make sure we pat it dry, okay? And we do it gently to avoid any bruising or any shearing or any friction when we're actually drying things up. So these are all important. Make sure you actually pay attention and you actually do this. And when they talk about here, you see here it's actually highlighted the do not put lotion between the toes. You don't want to be putting lotions. You just want to keep it dry. Lotion is going to keep it moist, and you want to lessen the moistness of the skin, because when skin gets moist or gets too moist, there may be increased chance of openings in that area, especially in between the toes. So remember, if you're a home care aide, you're a home health aide, you're a homemaker, home caregiver, your job is not to cut toenails. Never ever cut the toenails, especially if a client has diabetes, okay? I know they may be asking you a favor to do it, but you cannot do that for them, because that can increase the chance of them by you nicking them and causing problems later on. If the patient has a skilled nurse, have the skilled nurse do that for the client. Now, if the patient has a physician and they need to have some toenails taken care of, any of those things, have them see a podiatrist. Okay. Moving on to talking about dietary stuff and additional items we need to talk about in regards to the care of a client with endocrine system. A meal plan is very important to have, especially with a person who has diabetes. A plan or menu that includes all the right types and amount of food that should be eaten for each day is important. Carb counting is that counting the number of carbohydrates for each meal or the snack. We need to look into that, especially diabetic clients, okay? Exchange lists, it's the list of similar foods that can be substituted for each other on a meal plan. And this is something that you can research on, or you can actually deal by having the patient or the client talk to a nutritionist. Think about this question: why will a client with diabetes help the dietitian to create his diet? Because it has to be custom for them, and that's why a dietitian or a nutritionist needs to be brought in there. Look, they need to be part. You're going to tell the nutritionist, that dietitian, what type of food that they like. Okay, because you want to be able to make sure your meal plan is something that you appreciate, that you like, that you created. If you created something, you're more likely to want to follow it rather than somebody just handing you over and say, do this and do that. Okay? Remember, as a home health aide, as a homemaker, caregiver, your job is to observe what and when the client eats. Okay, and make sure you note that. If you're a caregiver and you guys are not providing non-medical services, you need to make sure that you take note. Is the client eating? Are they drinking enough? Because remember, and we need to encourage that. Because the reason why we have to encourage them to eat, we need to encourage them to be active, we need to encourage them to be able to drink, is because these clients, we depend on them to stay home longer. And if we don't become an assistant or an advocate for them for the care that they need and they deserve, then the chances are we may lose them as a client and they end up in the hospital or a skilled nursing facility or a long-term care facility, and we lose a client ourselves. So our job as homemakers is the first front line to be able to care for them and keep them longer at the comfort of their homes. All right? Now, moving on to reproductive system disorders and related care guidelines. Okay, now we're going to the reproductive system. So STIs, or sexually transmitted infections, okay? So also known as STDs is also another thing that you can use them as. Infections caused by sexual contact with infected people. Signs and symptoms are not always apparent and differs for the type of infection. So think about this. What are the different forms of sexual contact? Okay? And this is very important for us to be able to know. And if you guys are not aware, the fastest STD growing population in the United States is actually the senior community. And the reason for that is because of the new medications out there, such as Viagra, Cialis, and those type of medications. So a lot of seniors nowadays are still active and has a sexual, as active as sexually wise. And so because of that, and a lot of the seniors being, living in the back of the days of them not actually being used to using condoms or any protection, then that increases the chance of that. Okay, so what happens is we have a large amount of STDs population in regards to the senior population growing, and that's a known fact. Okay, so let's talk about chlamydia, because we will and may face clients that has this. So a chlamydia is that, is a pelvic inflammatory disease. The symptoms happens where there's a yellow or a white discharge that's coming from the penis or the vagina, and there's that experience of burning with urination. And the treatment for this is antibiotics. Next thing is syphilis. Syphilis, on the other hand, if left untreated, can cause brain damage, mental illness, and even death. So untreated infection spreads to the heart, to the brain, and other vital organs as well. So some of the symptoms that you're going to see, those canker sores, the rash, a sore throat, even fever that may occur. The main treatment for this is penicillin or any other antibiotics. Moving on to gonorrhea, what happens is gonorrhea can cause sterility, it can cause blindness, and even joint infections if untreated. So for men, they show greenish or yellowish discharge from the penis, painful testes, burning with urination. Now for women, they don't really show any early symptoms at all. And of course, the treatment is antibiotics. Now, we talked about the first few ones being bacteria. Now we're going to move on and we're going to talk about something that is a virus. So that's a herpes. It's caused by the virus HSV, 1 or HSV2. So herpes virus. The treatment is any antiviral drug that can be given, but herpes cannot be cured. We can only kind of look at it and actually have it become dormant. So if somebody does have herpes, they may have repeat outbreaks for the rest of their lives, okay? So some of the symptoms includes burning, painful red sores on the genitals. So if a child is born to an infected woman, they can be infected once they actually pass through the birth canal. So if somebody actually has a herpes or has herpes virus, and they're about to give birth, normally suggestion is that we actually give the child given birth by a C-section. So moving on to other immune system disorders now, we're going to talk about AIDS and HIV. So AIDS is an acquired immune deficiency syndrome, okay? So what that is, it's the final stage of HIV infection in which infections, tumors, and central nervous system symptoms appear due to that weakened immune system that is unable to fight infection. Now, HIV is the virus now. So that's a human immunodeficiency virus. It's that virus that attacks the body's immune system and gradually disables it. So a person may have HIV but does not have AIDS. But if somebody has AIDS, that means they have the HIV virus. So let's talk about the AIDS dementia complex. It's pretty much that group of symptoms such as memory loss, poor coordination, paralysis, and confusion that occurs later in the stages of AIDS due to pretty much damage in the central nervous system. All right, moving on, we're going to talk about Kaposi sarcoma. What's a Kaposi sarcoma? Those are the rare form of skin cancer that appears as purple or red skin lesions. The pneumocystis pneumonia is a lung infection. Opportunistic infection, on the other hand, is infections that invade the body when the immune system is weak and unable to defend itself. And neuropathy is the numbness, tingling, and pain in the feet and the legs. So, typically a person with AIDS, the autoimmune deficiency syndrome, what happens is they don't really die from that virus. They die from a lot of the immune system being weak and then the opportunistic infections that happen. So a lot of people that actually have AIDS, die because of a lot of respiratory problems. A lot of pneumonia is some of the big reasons why they actually have that, the death actually happens. So, we need to be able to know facts about HIV and AIDS. Once again, it's acquired immunodeficiency syndrome. It's caused by the HIV virus, okay? HIV attacks the immune system, and it breaks down your immune system that you cannot fight any opportunistic infections, okay? It can take years for HIV to develop into AIDS. HIV is transmitted by sexual contact. There's the blood as well, infected needles, and also can be transferred from mother to fetus as well, okay? So beginning symptoms, at transmissions are pretty much just like flu. So other facts we need to know is later symptoms includes opportunistic infections. Those are the tumors, the CNS symptoms as well, or central nervous system symptoms. Late stages of age includes dementia complexes, where you have confusion and dementia. What happens is the opportunistic disease invades the weakened body. Your immune system is gone, so you cannot fight these diseases. So other diseases is gonna jump in there for you. So the main treatment is medication. Okay. And at this moment, there is still no cure and not even a vaccine at this moment to prevent it as well. So let's look at additional signs and symptoms of HIV and AIDS. So you have the flu-like symptoms in the beginning. That's one thing. And then you have appetite loss, weight loss, night sweats, swollen lymph nodes, severe diarrhea, dry cough, and skin rashes as well. And other things that comes up is painful white spots in the mouth, cold sores, warts caused by human papilloma viruses, inflamed and bleeding gums, bruising that does not go away, susceptibility to infection, Kaposi's sarcoma. So you have these red and purplish spots in your face, unfortunately, in your skin. Pneumocystic pneumonia, and then AIDS dementia complexes is those groups of different problems that starts happening, such as your later on your stages of dementia and confusion as well in there. So remember, when we're caring for people, especially with immune system disorders, especially with AIDS and HIV, is using standard precautions. It means treating all body and blood fluids as if they carried the infectious disease. Okay, you want to be able to follow the standards of precaution. It is important when caring for all clients, not just a client who has AIDS or HIV. Remember, we don't know that at times, and so when we're caring for somebody, when we're handling somebody that has antibody fluids or blood fluids and all that stuff, we need to make sure we do follow the standards of precaution to be able to also, one thing is keep us safe and keep the client safe. So here's a question, what are some of the unique emotional stresses of having HIV and AIDS? So, put yourself in a spot or put one of your loved ones in the spot if they ever have that. What would be faced out there? What are unique emotional stresses that can happen? What are some of the stress and difficulties that you may face when caring for clients with HIV and AIDS? Are there going to be times where it make you think twice before you want to care for someone? Is this something that you want to handle or not? Either or, we have to look at a lot of different things when we're caring for clients. There's so many different things that's even worse out there than HIV or AIDS that can kill a person faster enough. So we need to also watch those and understand that everybody that has a diagnosis, whether HIV or AIDS or whether it's just flu symptoms or cold symptoms, we need to make sure we provide care for them. That's what we're here for. Okay, moving on, we have talk about cancer, tumor, benign tumors, malignant tumors. Okay, so now we're getting into tumors, as Arnold Schwarzenegger would say. So cancer is a general term to describe a disease in which abnormal cells grow in an uncontrolled way. Tumor, on the other hand, is a cluster of abnormally growing cells. A benign tumor is a tumor that are considered non-cancerous, so it just stays in one spot, it doesn't transfer. Whereas a malignant tumor are tumors that are cancerous, they spread and they can go to other areas. So let's talk about facts about cancer. General term describing many types of tumors. Pretty much, tumors can be benign or malignant, and also there is no really cure for that. Understand these risk factors for cancer. Some of the things that affects and that could cause the increased chance of cancer is age, race, gender, family history, tobacco use, and alcohol use as well. Other risk factors would be including poor diet, obesity, lack of physical activities, chemical and food additives, radiation, and exposure to sunlight as well. Okay, so here are the warning signs of cancer, and you need to know these things: unexplained weight loss, fever, fatigue, pain, skin changes, a change in bowel or bladder habits as well. More warning signs will include sores that do not heal, unusual bleeding or discharge, thickening or lumps in the body, indigestion or difficulty swallowing, new mole or recent changes in mole or a wart, nagging cough, or even hoarseness. All right, we need to be able to familiar with treatments for cancer and be aware of their side effects, such as any surgery, chemotherapy, as well as any radiation. All right, so each case is different. With somebody who has cancer, we need to make sure that we respect each client's communication needs. We want to be able to observe signs and symptoms and how we can actually be comforting to the patient and how we can alleviate and be there for them. We want to assist them, especially with oral care or any other care we need to give them. If need be, assist with grooming as desired. Always make sure that we're there for the client. We cheer for the client. We want to be able to be supportive for the client and also be alert for the client as well as the family needs as well. Now, these are things that we need to make sure we report if we see increased weakness or fatigue, weight loss, nausea, vomiting, diarrhea, changes in appetite, fainting, signs of depression, confusion. If there's any blood in the stool or the urine that's noted, any changes in the skin or their mental status, or are there any new lumps, sores, or rashes, or how about the pain? Always make sure we address the pain. The pain needs to be addressed fully. Is there increase in pain? Is there a decrease in pain? Is there pain that's not being relieved with whatever medication is being given? We need to make sure that we look into that. Okay. All right. Moving on, we need to be familiar with these community resources for clients with cancer. We just need to make sure we know that stuff. Okay, if the client has cancer, there may be things that we need to be able to provide for them. So we need to look into what hospitals in the area, what programs like in hospice, churches, programs, meal services, transportation, counseling, support groups. Looking, just like with Alzheimer's and joining Alzheimer's disease programs, also joining the American Cancer Society is important for you to get yourself educated, as well as your local agency in aging as well. Very good resources to be able to know and to have so that we can actually provide the information to the client if they actually need it or ask for it. Okay, so we just covered literally pretty much a lot of the different disorders that you're going to be facing, all the way from integumentary, which is the skin, all the way to immune system, respiratory, cardio, all these things. And it's very good to be able to know that and pay attention to it. By being able to know what we're going to see, what we're going to expect, allows us to be able to provide the care needed for the client. So thank you so much for watching this particular video and this information. Hopefully it's very informative for you. If you need to make sure that you need more time, please review the video all over again. That's what this video is here for, to provide you all the information that you need so that you can provide great care for your clients.